Thanks for watching The 9.
Okay, well, spring is approaching.
Yeah, oh yeah, it is.
I mean,
every day. We're
right.
a day closer.
There we go. That's straight from the meteorologist. So children, adults preparing for maybe a new round of sports. So when we talk about the kids, we talk about these spring sports seasons kicking in: baseball, softball, track, and of course golf for the adults and other things too. Dr. James Bicos with Michigan Orthopedic Surgeons is here. Doctor, thank you for coming in.
Good morning. Thank you for having me.
We know that as our kids tend to lean towards playing year-round sports, that you see a lot of these overuse injuries that can be avoided, right?
Oh, absolutely. And spring is a big time for that. You know, we're getting back into sports, so sprains, mostly of the joints, and then strains of the muscles. But again, the overuse of maybe kids doing too much too soon and not preparing either.
And playing the same sport year-round.
Correct.
I know you're not a fan of that.
Neither am I, by the way. I hate that.
Yeah. But Doctor, just real simple, is it warming up properly, or what can you do to avoid these sprains or strains?
Well, definitely starting early. So starting now. I mean, something to get cardio going, starting some simple stretching. You don't need a big gym workout. I mean, anything you can do at home, 15, 20 minutes a day can help. Definitely warming up. Warming up increases body temperature, increases muscle temperature, also increases our muscle reflexes. That's the stuff that almost helps to prevent us from getting injured. All very important.
You're just talking about the overuse in the single sports. I see more football players at a young age have ACL injuries than ever before. More baseball players have Tommy John surgery than ever before. Young players, in fact, doctor, a lot of people say your career won't start until after you have your Tommy John surgery. I mean, that is a horrible thought.
It is, yeah. And some of that is, kids are getting faster, stronger. Some of that is because they're playing year-round sports. But that's where we can take a lot of preventative measures. And one of them is to kind of diversify a little bit. Take maybe one season to do something different than your primary sport. It helps to distribute the forces differently with the body.
When we talk about, let's just take Tommy John surgery, that involves what, a tendon? What is that? The
right?
tendon?
Yeah, so a tendon on the inside of the elbow, as pitchers are throwing, that can either get kind of partially torn or sometimes stretched.
Okay, so when you're talking about a tendon, when you keep using it, I mean, there's no stretch that's going to protect that, or is there?
No, there isn't. But again, kids, as we say, are not little adults. So the issues with kids is they have open growth plates, right? So the way they get taller, that growth plate forms bone, but that's also the weakest part of bone.
Oh.
So with repetitive injuries, such as baseball year-round or how much they're throwing, that part can get easily injured. So although you're still doing the same activity, it's just watching how much you do.
Doc, I had ACL reconstruction about 2-3 years ago, and I gotta be honest, I still mentally am not in a place where I can do the activity that I hurt my knee doing. When it comes to kids in sports, how do you tell them to approach it?
Well, I mean, a lot of that goes somewhat by their rehab. Obviously, we fix them, they feel better, but again, a lot of that can be mental too, them wanting to get back to that sport, and it's variable. I think you have to look at the kid and the family and the environment and see what they want to do, because not everybody's the same either.
Yeah. Can I ask you just about the older folks? A guy like me who can't walk or play football or baseball or anything. Pickleball is a big sport that a lot of older people will play now, or maybe even going to an outdoor basketball situation. What would you suggest, maybe somebody that's a little bit older do to prepare their bodies to play a sport?
Yeah, so interesting you say pickleball. People are like, oh, it's easy tennis. And although it's smaller than a regular tennis, I mean, you're still exerting, and if you don't warm up properly because you think, well, it's just easy, you can get a lot of injuries.
Pickleball is a lot of stop-start, stop-start.
It is. And it really, it's the same mantra. It's you got to make sure to warm up, get the muscles kind of ready, and cooling down also important, right? Regulates body temperature, gets your heart rate down, and then gets rid of things like lactic acid, which then can build up and cause a lot of aches and pains.
The cool down is my favorite part. It's over.
Yeah. All right, and surgery is always the last resort.
It is, and we try to make it that. But again, something like an ACL tear, that's something where it needs to be managed surgery.
Yeah.
Most of the time, it is non-surgical.
All right,
great
Dr. Bicos, thank you for coming in.
Thank you.
Now we just need some warm weather.
Right.
We had some. It's just gone now.
We'll get some back.